This was an individual who was trimming trees and fell from his truck onto the asphalt. This is the initial CT scan from the patient's study, and the initial run-through suggests that the patient has had an injury in the scalp at the high left frontal region. We're going to look at the calvarium in just a moment. But the next thing one sees in a flash going by is some hyperdensity along the top of the corpus callosum, and maybe a little bit of blood that's collecting in the lateral ventricles. We look at the patient's calvarium, see that there are no fractures. Coronal scans would be helpful to look in the gyrus rectus region for hemorrhage or contusion, as well as the anterior temporal lobes. And we wonder about a collection here along the floor of the middle cranial fossa on the left side. We see some of that blood products adjacent to the lateral ventricles. The patient was not doing well and got scanned 6 hours later as part of the protocol. Here on the 6-hour scan, we start to see a little bit more density than we're comfortable with along the tentorium, suggesting that there may be a subdural hematoma layering along the tentorium. And now we see more clearly intraventricular hemorrhage in the occipital horns of the lateral ventricle. As you recall, this is usually a marker for an injury to the corpus callosum, usually the posterior body or the splenium. So a little bit of blood products also seen near the foramen of Monroe on the left side. Since the patient was doing very poorly and yet the imaging was relatively mild, the patient was referred for MRI scanning. The MRI scan, if we look at the initial flare image, you note that the normal low signal intensity of the subarachnoid space that should be present on a flare scan, as you can see in the cerebrospinal fluid of the ventricles, is lost over the high convexities. This bright signal on flare scan is an indicator for subarachnoid hemorrhage. Now, this may be anything of pathology in the subarachnoid space, so it can be meningitis in a different situation. So there's subarachnoid hemorrhage, and we see that indeed there is injury to the splenium of the corpus callosum, and there is blood that is seen within the occipital horns of the lateral ventricles on the examination. The next thing as we go downward we start to see is abnormal signal intensity in the back of the brainstem at the tentorial edge. Remember that I said that an acceleration-deceleration injury site of pathology includes the posterior midbrain as the brain goes forward and back and the midbrain bangs up against the hard dural margin of the tentorium. This is what you are seeing here in the midbrain, more on the left than the right on this flare scan. You note that even in the posterior fossa, the vermian subarachnoid space is bright on flare scan, which is abnormal. We then move from this to our diffusion weighted scan. Why do we look at the diffusion weighted scan? Diffusion weighted scans are useful in identifying some of the shearing injuries that can occur in trauma because they do induce cytotoxic edema. And indeed, in the splenium of the corpus callosum, we see bright signal intensity on the DWI scan, likely from a shearing injury. Shearing injury, diffuse axonal injury, rotational deceleration injuries are all part of the same spectrum and are used relatively interchangeably. The most important sequence, however, that we want to look at is the gradient echo or susceptibility weighted scan. In this case, a gradient echo scan was performed on this 1.5 Tesla scanner that did not have SWI pulse sequences. Nonetheless, even using gradient echo scan, we can see that there are multiple dark signal intensity foci at the gray-white interface characteristic of shearing injuries of the white matter. You see that they are these little black dots that are bilateral in this individual. Not only that, but as we get to the splenium of the corpus callosum, we see that indeed there is hemorrhage in the splenium of the corpus callosum and along the posterior septum pellucum, extending to the edge of the splenium. You also see intraventricular hemorrhage on the gradient echo scan. As we go further inferiorly, we do see some of the blood products in the back of the brainstem. So these little black dots represent hemorrhage in the back of the brainstem, in the midbrain, where the midbrain has apposed against the edge of the tentorium. And here in the vermis, you also see blood products demarcated by the dark signal intensity. So this is another example of a patient who did not do well and was subsequently shown to have a much more extensive degree of injury from diffuse axonal injury demonstrated on the MRI scan. There's one more scan that was performed 4 days after the MRI scan, and as you can see, the CT just will totally underestimate the degree of damage that has occurred. You had the CT scan beforehand, you had the CT scan after, and they just look relatively mild injury when we know that there has been a devastating injury at the gray-white junction. This patient has what one typically sees is a pressure bolt to monitor the intracranial pressure as part of the therapy for the patient.